On this slide, I would like to explain you the differences between two types of diabetes mellitus. There is type 1 and there is type 2. And there are, over here on the left side, there are certain distinguishing criteria. And I would simply like to go through this table with you. In type 1 diabetes, it starts during childhood, and type 2 diabetes starts after childhood. And in both cases, you have a problem regulating blood glucose level. And maybe that's one similarity that I should have written somewhere. Both types of diabetes have problems regulating blood glucose, but it starts at different times of a person's life. There is a different cause. In the first case, in type 1 diabetes, there is a lack of insulin due to the damage of beta cells in the islets of Langerhans in the pancreas. And this could be due to an autoimmune problem. So the body's immune system starts to attack these beta cells, which are normally responsible for producing insulin. And when the body's immune system starts to attack these cells and kill them off, then they are not able to produce the insulin anymore. And in type 2 diabetes, the body cells, so we're not talking about the pancreas now, we're talking about the cells of the liver or the muscles, which reduce the blood glucose level. These body cells grow insensitive to insulin. So insulin is present, but the body does not respond. And over here, there is not enough insulin in the first place. And if there is not enough insulin in the first place, you can inject it. So that is the type 1 diabetes. The people have to measure their blood glucose level, or nowadays you have small devices that do that. And then you have to inject insulin appropriately. And now over here, if the body doesn't even respond to insulin, there is no point in injecting it. So here the only possibility is you have to reduce your sugar intake, your carbohydrate intake, and also a low starch diet. Don't forget that starch is made of long chains of glucose. If you have a low carbohydrate intake, then you can also try to reduce the blood glucose level. We already talked about diet issues over here, but people with type 1 diabetes, they can have a more or less normal diet, or at least the diabetes cannot be controlled over the diet because the problem is somewhere else. The problem is with the beta cells. And in type 2 diabetes, where people should have a low carbohydrate diet, they have to ensure that they still do not eat too much fat, and they should have a high fiber diet because fat-rich and low-fiber diet increases the risk further of type 2 diabetes. So type 2 diabetes is also associated more with obesity and an unhealthy lifestyle in addition to that. Because this lifestyle issues somehow influence the body's cell to grow insensitive. So this was basically an overview of these two types of diabetes mellitus. In both cases, a problem in controlling the body's blood glucose level.